Not
Okay. Okay. That says that we're recording the meeting and we are ready to start. And I'm just going to introduce Dr. Benora. Most of you know him. He is a gynecologist and director of menopausal health at St. Catherine of Siena Medical Center. So without further ado, Dr. Benora, I'll turn it over to you now.
Can you hear me? Hello?
We can hear you. We can hear you.
Okay. You ladies know who I am. My name is Dr. Benora. I'm Director of Menopausal Health here at St. Catherine's. We have a program for women approaching the menopause and women who are menopausal. And I take care of those ladies who have hot flashes, night sweats that affect the quality of their life. I take care of ladies who have vaginal dryness, pain with relations, women with osteoporosis, and women who have recurrent bladder infections. And we also have in our program physicians who have expertise in conditions such as heart disease, pulmonary disease, neurological disease, gastrointestinal disease, and breast cancer. So we have a whole program. We have the only program in Suffolk County and probably in Long Island. Now, today's topic is a condition. Urinary tract infections are a condition that I see quite frequently in my practice, because my practice are mainly women approaching the menopause or who are menopausal, but young people also get urinary tract infections. Now, urinary tract infections are a general term. It means it can be an infection anywhere in the urinary system. It could be in the bladder. It can be in the tube you pass your urine from. It could be in your kidneys or the tubes that go from the kidneys to your bladder. Urinary tract infections are the most common bacterial infections in men and women, but mostly in women. 50% of you ladies out there, regardless of your age, will have one urinary tract infection, usually a bladder infection, which is the most common in your lifetime. And if you do get a bladder infection, 25% of you will get a recurrence within 6 months. Now, it's more common in ladies because your distance from your anal area to the opening of your bladder is only 2 inches, where in a man, it's at least 6 inches or more. Now, the normal bladder has a lining in it, and its cells make a substance we call the gag layer, that when a bacteria gets into the bladder, if it's just a few of them, it can attach. Also, your constant production of urine flushes out your bladder, and urine is normally sterile. There are no bacteria in your urine. And those ladies who are out there who are not menopausal, the estrogen that your ovary makes the bacteria in your vagina make an acid. So when germs come in from the anal area, and that's what usually causes bladder infections, they're killed. Whereas when you're menopausal, and those are the ladies we see a lot of bladder infections, you don't have that acidic barrier. Germs get in, they go up into the tube that you pass your urine from, they overpower that layer inside the bladder, and they cause a bladder infection. Now, the number one bacteria that causes a bladder infection or a urinary tract infection comes from your anal area, and it's called E. coli. Now, E. coli have little fingers. When they get into your bladder, they attach and they secrete a toxin, and they cause an inflammation. You ladies who are menopausal, it happens to you because you don't have the acidic barrier. Now, the risk factors for a urinary tract infection, if you're not menopausal, can be if you had a previous urinary tract infection, if you have diabetes, if you're overweight or obese, if you have frequent sex, especially if you have multiple sexual partners, and if you have rectal sex followed by vaginal sex, you can get a bladder infection. In you menopausal ladies, it's due to the fact that you are not making any estrogen and you have no acidic barrier in your vagina. Also, if you've had a previous UTI, you can get another one right away. And many of you from childbearing have a drop bladder. We call that a cystocele or a drop uterus, and you don't really emptying your bladders properly. And urine stagnates and you get a urinary tract infection. Now, the symptoms are quite common for a urinary tract infection, especially a bladder infection. You have painful urination. It burns when you pass your urine. You have frequency. You pass frequent small amounts of urine. You have urgency. You have that urge to void. And when you look at the urine, it changes color. It can be cloudy. It can be pink, or it can be Coca-Cola color. That's blood in your urine. And when I examine you and touch you on your hairline and your abdomen over your symphysis bone, you may have tendons. Now, you don't have fever, you don't have back pain. If you have fever and back pain with those symptoms, you have something serious. You have a kidney infection. You don't have a bladder infection, you have a kidney infection. Now, how do we make a diagnosis in my office? Well, you have these symptoms. My office nurse, Jeanette or Jackie, takes a dipstick. It's a little piece of paper, dips it in your urine and looks for, and it tests positive if you have a urinary tract infection, for white blood cells, red blood cells, and nitrites. And if you have that with symptoms, I can be 75% sure you have a bladder infection. And then we collect a urine from you for a microscopic analysis. We're looking for red blood cells, white blood cells, and bacteria. And we do a culture and sensitivity. That takes 3 to 4 days. If you have those symptoms and the dipstick is positive, I will treat you, because you can't wait 3 to 4 days with symptoms of urgency, burning, frequency. And then we get our culture back, and the culture tells us what the bacteria that cause it and what are the sensitivities. And then what I do is I'll treat you with an antibiotic. And we treat you for an antibiotic for 3 to 7 days. Now, many times a patient will call my office and say, you know, Dr. Benora, you were off on Saturday or Sunday, and I went to an urgent care and they treated me with Cipro. Cipro. The FDA came out in 2016. All of you should remember this. When your doctors order Cipro for an uncomplicated UTI, but that didn't mean a bladder infection, they came out in 2016 and said, if you take Cipro, you can have permanent damage to your muscles and your tendons. In 2018, they came out with even a better warning, or a more serious warning, and said, if you take Cipro, you can develop hypoglycemic coma, delirium, and confusion. And they advise, for a bladder infection, never ever to use Cipro. So that's so important. If your doctor's ordered that, you can quote me and you can quote the FDA. We only use Cipro we sometimes use it if you have a kidney infection. Now, how can you prevent, you ladies out there that are watching the program, how can you and your daughters and grandchildren prevent a bladder infection? Well, one, increase your fluids, especially water, so your urine constantly flushes the lining of your bladder. Secondly, have a glass of unsweetened cranberry juice a day. It can also, or take a cranberry pill twice a day. It can prevent bacteria from attaching, some studies show, to the lining of your bladder and prevent a bladder infection. Also, always wipe from front to back when you go to the bathroom. And those of you that are sexually active, after sex, empty your bladder and then have 8 ounces of water. Some of my patients sometimes say, well, Dr. Benora, I seem to get a UTI after sex. We tell them empty the bladder after sex, drink a glass of water, and we give them an antibiotic to take for 1 or 2 days after they have intercourse. Now, the problem that I see in my practice and why I used to go to 7 nursing homes is a recurrent bladder infection. And in the elderly, what can happen is they get a bladder infection, and then 2 months later, they're treated again. They get another one. Eventually, they get a kidney infection, they get sepsis, and they can die. So what we do in you ladies, if you're premenopausal, the definition of a recurrent bladder infection would be 2 bladder infections, 2 UTIs in 6 months or 3 in 1 year. Once we clear up the bladder infection that you have now, we put you on a different antibiotic once we clear it up for 6 months to a year, and we can reduce your risk of a bladder infection by 95%. You ladies who are menopausal, who lost that acidic barrier, not only do we put you on an antibiotic for 6 to 12 months, but we acidify your vagina. And I did this in the nursing homes to your grandmas with vaginal estrogen in a tablet, a suppository, a ring, or a cream, or we even use intrarosa, which is DHEA. What we're trying to prevent is a complication. And the complications of a bladder infection are a kidney infection. And a kidney infection can cause kidney damage, sepsis, and even in death if it's not treated. Questions?
Dr. Benora, we've gotten a couple of questions via email, so let's get the conversation started with those if we can. What happens when I become resistant to the antibiotics?
Well, then we try to find an antibiotic that you're not resistant. The one that I found is called monourol, it's phosphomycin. It's used a lot in Europe, and I use it a lot in my menopausal women. It's a drink, they're crystals that you take 1 drink today, and then you repeat it in 3 days. And many bacteria are not resistant to monourol. But when we get back your culture and sensitivity, the sensitivity tells us which antibiotics it is sensitive to.
Okay, so you would be able to tailor the treatment.
We're able to tell which antibiotic to give you. Remember, the therapy for a urinary tract infection is individualized. It's not one antibiotic for all of you. Do you follow that? And that's why it's so important to get a culture and a sensitivity. To treat people blindly, we don't do that. If I'm treating you when you're in my office and the dipstick is positive and I put you on an antibiotic for 3 days, I also collect a culture and sensitivity because you may not be sensitive to the antibiotic I gave you. We always do a culture and sensitivity.
Thank you. Okay, another question that came in through email. What does the doctor think of Uqora products, UQORA, to prevent UTIs? It says that it's all natural. Have you heard of that?
I don't know this product, but I do know that some studies show that cranberry juice, unsweetened, is an excellent source of vitamin C. And I recommend that in my patients. I recommend that, lots of fluids or cranberry. I tried cranberry juice. It's so bitter. I would take a cranberry pill twice a day. And tell your husbands, many men who are middle-aged or older have prostate problems, and they can present with multiple recurrent urinary tract infections. They should also follow the advice. Of course, they're not going to use vaginal estrogen, but their doctor should put them on a daily antibiotic, and they should drink lots of fluid and take cranberry pills.
Okay. Now we'll open it up to the floor. So if you have a question, feel free to type it in the chat. I can read it out to Dr. Benora, or just unmute your microphone and go ahead and ask your question. This was very, very informative. What's the typical age of somebody who gets a urinary tract infection? Can it happen to women at any age, or is there
Oh,
a
yes.
typical?
I treat young ladies who have UTIs, and some of them have recurrent. We have several in my practice now. Young ladies have recurrent UTIs. They would be put on a daily antibiotic. Sometimes we might even work them up. We might do an IVP, we might do a radiological study on them, or we might send them to a urologist. But in menopausal women, what works is an acidic barrier in the vagina from either estrogen or DHEA intrarosa and a daily antibiotic. Those that are resistant to that therapy, then I would get a urological consultation. But 9 out of 10 times, they all respond to it.
I'm going to pause here and see if anybody else has a question. If not, I will go ahead and ask my next question. Dr. Benora, is there a risk of a more serious complication for a woman who has recurrent UTIs, or is it just the discomfort and the inconvenience of it?
The risk would be it can ascend up the tubes from your bladder to your kidney. Not only will you get a kidney infection, which requires sometimes hospitalizations and IV antibiotics, but it can cause kidney damage and sepsis. And sepsis is one of the leading causes of death in seniors.
So it does need to be addressed right away. Obviously, it could have serious complications.
Right. And anytime a woman has a bladder infection and she develops a fever and she develops back pain with it, they must call their physician. And if they're not available, they should go immediately to an emergency room, because you don't get a fever with a bladder infection.
So the fever indicates that it's progressed to something.
It's progressed to your kidneys, right?
Mm-hmm.
Well, I guess that's it. Takeaway point, ladies, to prevent a bladder infection, drink lots of fluids, especially in this warm weather. By doing that, you're flushing out your bladder lining. And if there are any tiny little bacteria in your vagina, in your bladder, they'll be flushed away. Take a glass of cranberry juice a day, or a pill twice a day. They're safe to take, and some studies show it can prevent a bladder infection. And if you have recurrent UTIs, go to a physician that can prevent them. Most physicians know how to prevent them. If they don't, try to find someone that knows how to prevent them. And if you're menopausal, we prevent them with a daily antibiotic, and we acidify your vagina with vaginal estrogen or DHEA intrarosa. And that would be it. So enjoy your lunch. And as we say in Italian, ciao.
Thank you, everyone, for joining.